Good afternoon, everyone. On behalf of Results for America and our partners, the National Academy of Public Administration, I want to thank you for joining us today for this conversation about the future of evidence-based policymaking at the federal level. First, as many of you know, Results for America helps governments deliver better results for kids, families, and communities by harnessing the power of evidence and data to invest in what works and improve the results government delivers for all Americans. We believe this is more important than ever as governments address the public health, economic, and racial justice challenges that are facing our country right now. Most importantly, I want to recognize today the talented civil servants at federal agencies who have kept the bipartisan momentum for evidence-based policymaking going over the last several years. I'm thrilled that many of these data-driven leaders will be speaking shortly. Because of their hard work and the foundation that they've laid, we have a tremendous opportunity now at the federal level to build a more efficient and effective government to deliver the results this new administration needs. But to accomplish that, it will take all of us working together. We need Congress to help increase investments in building evidence and to target dollars toward solutions that have evidence of impact. We need federal agencies in the new Harris administration to take the steps they need to accelerate the use of evidence and evaluation in decision-making. And we need the new White House and OMB to help ensure that data and evidence are a top priority for the new administration. There's a ton of potential to be unlocked and significantly more that can be done as you'll hear today. Before we start, I want to thank our speakers, Terry, Ben, and Melody. I also want to thank the 9 federal agencies for once again participating in Results for America's Invest in What Works federal standard of excellence. These 9 agencies are truly at the cutting edge. Now I'm going to hand it over to Jed Herrmann, who's Results for America's Vice President of State and Federal Policy Implementation. Jed?
Thank you, Michelle. Thank you to everyone for joining us this afternoon, albeit virtually. As Michelle noted, the need for evidence-based policy has never been greater. And with a new Congress and administration, we are here today about the unique and bipartisan opportunity to increase investments in what works. But before we get started, I want to let you know that for the first time ever, we'll be live streaming on Twitter. And we also encourage everyone to live tweet the event and continue the conversation using the hashtag that's on your screen. Today, we're releasing the 2020 edition of Results for America's annual Invest in What Works Federal Standard of Excellence, which outlines the progress that federal agencies have been making to use evidence and data for decision-making. In particular, these 9 agencies represent the best of what the federal government is doing and have made important strides to implement the Foundations for Evidence-Based Policymaking Act, which took effect in 2019, by putting in place key evidence and data leaders who are working to infuse research into their agency's way of doing business. We'll hear from these leaders shortly, but first, I want to talk a little bit about what this year's Federal Standard of Excellence contains. So it identifies some key achievements by these 9 agencies that have set a clear example for other federal agencies to be doing in order to get better results. For example, half of the agencies here today invest 1% or more of their budgets in research and evaluation activities. Beyond this, these agencies are increasingly invested in evidence-based grantees and interventions. This year, they collectively allocated grant funds using evidence in 39 competitive and non-competitive grant programs for a total amount of $45 billion in spending. This is 4 more programs and $4 billion more than last year. As an example of this growth in evidence-based grant making, this year AmeriCorps invested 51% of its funds in grantees who have moderate or strong evidence of effectiveness. This is compared to 27% of such funds going to grantees with this level of evidence in 2017. This great growth is translating into measurable impact in communities across the country. You can read more details about this in the press release, which is in your chat box at this time. Moreover, the agencies also reported and shared updates on their draft evidence capacity assessments, learning agendas, evidence plans, and other deliverables that are required by the Foundations for Evidence-Based Policymaking Act. These agencies are also growing the larger evidence ecosystem by funding technical assistance to support grantees, including states and localities, to help them better leverage federal resources to build knowledge about what works. You can read even more about what these agencies are doing and their individual accomplishments in the agency snapshots we've produced for the first time this year and which are linked in the chat as well. I want to congratulate these agencies that are joining us here today for their leadership and for their accomplishments. We'll hear from them shortly. But in the meantime, I want to introduce Melody Barnes, who's the former White House Domestic Policy Council Director and a senior fellow at Results for America. Based on her experience in 2009 at the start of the Obama administration, Melody can help us understand the opportunity presented by a presidential transition and how evidence-based policy can help meet the moment. Melody?
Great. Well, thank you so much, Jed. I appreciate the introduction, and it's wonderful to be with all of you this afternoon. I also want to thank Michele and Terry and the Results for America and NAPA teams for co-hosting this afternoon's event. It is, for all the reasons that Jed mentioned, timely and important. We're at an important moment for the advancement of evidence-based policymaking. The crises facing our country are dire. The need is great, and there's no more important moment to identify, support, and grow policies and practices that are actually going to meet those needs and to solve our problems. I want to echo Jed and thank the career government staff who are implementing the Evidence Act and offer additional evidence why that work must continue. As Jed mentioned, I served as the first DPC director at the outset of President Obama's term in 2009. And as we began our work at 1600 Pennsylvania Avenue, at a time of grave economic crisis, we recognized that evidence and data were critical tools. Evidence-based policymaking was a key promise of President Obama's campaign, and the tone was set before we walked into the White House. We'd focus on investing in what works. And we focused on investing limited resources to scale up programs that were already working. As the political scientist Ron Haskins has noted, we followed a disciplined formula to shape a policy agenda with data at the center. And in fact, Ron's books just sits over my shoulder. It's not just there for show, I often refer to it. Here were the elements of that work. One, we were going to select an important problem that would make individual citizens and the nation better off if the problem could be successfully addressed by social policy. We were going to identify model programs that have been shown by randomized trials or other rigorous research to significantly reduce the problem. Also obtain funds from Congress to scale up evidence-based programs, make the funds available to those with a track record of good performance to replicate the successful model programs and to develop new ones, and to continuously evaluate the projects as they were being implemented to ensure they were faithfully implementing the model program and producing good results. There were several flagship programs that came out of that approach, and I'm just going to mention one as an illustrative example. During the early part of his term, President Obama famously said, quote, "Solutions to America's challenges are being developed every day at the grassroots, and government shouldn't be supplanting those efforts, it should be supporting those efforts." The Social Innovation Fund was born of that belief. And I just have to pause for a moment to thank Michele Jolin for her tireless work, her creativity and advocacy to bring the SIF to life. As she knows, I often joke that the SIF is her fourth child. The SIF combined public and private resources to grow promising community-based solutions that have evidence of results in three priority areas. And many of you are probably familiar with this: economic opportunity, healthy futures, and youth development. There are four characteristics that were key to the SIF's work: reliance on outstanding existing grant-making intermediaries to select high-impact community-based organizations rather than building new government infrastructure; federal dollar matching, that's a one-to-one match by the grantees and again by their sub-grantees with money from private and other non-federal sources. So we were working very hard to increase the return on investment being made by taxpayers and strengthening local support and local stickiness and buy-in. Also, an emphasis on rigorous evaluation of program results, not only to improve accountability, but also to build a stronger marketplace of organizations with evidence of impact. And then effective leverage of the grant program through supplementary initiatives that advance social innovation more generally in the nonprofit sector. Importantly, SIF grantees also received strong technical assistance from the Corporation for National and Community Service to support implementation of their innovative programs. I can tell you personally, not just from the work that we did to build the SIF from the White House or observing the work that was done, but personally from work that I was involved with and had the opportunity to observe up close and personal, that there were important results that came as a result of the SIF investment, including Opportunity Works, which was the Jobs for the Future and Aspen Forum for Community Solutions initiative that supported 7 organizations, community-based organizations across the country that are building pathways to employment for young adults, and in particular, in this instance, for boys and men of color. Now, this work is not without its challenges, and those of you who are doing it know as well as I do that that's true. At the top of the list, there's often fear of failure and the political and budgetary implications of that. But all involved, and that includes citizens and policymakers, politicians, have to realize that this is an iterative process. A system of reassessment allows the government to collect more data on successful programs and operators to refine the structure of their programs over time. It allows us to learn while we're doing, to make changes and adjustments in real time to make sure that our results are just getting better and better. In conclusion, I know that our reality is one crowded with substantial challenges. That's where we are right now in this country. The economy, our stressed healthcare system, issues of racial and social justice are among those challenges. And the Biden-Harris administration is going to have its hand full. But evidence-based policymaking can be a potent tool, putting tested solutions on the table and, as the Urban Institute describes, using facts and experience of leading agencies like the ones here today and driving the discussion about the effectiveness of government programs in an era of ever decreasing public resources. We can bridge divides using evidence and fact and data. I know that I saw that when I had the opportunity to do this work at the Domestic Policy Council. And so with that, I'm going to turn it over to Terry Gerton, the President and CEO of the National Academy of Public Administration. Terry?
Well, thanks, Melody. As Melody said, I am Terry Gerton, the President of the National Academy of Public Administration. For those of you who aren't familiar with NAPA, we're not wine and we're not auto parts. We are one of only 2 congressionally chartered national academies, and we are charged with bringing the nonpartisan expertise of over 950 fellows to government agencies at all levels to help them address their public management challenges. One of the areas we specialize in is bringing an evidence-informed perspective to help develop solutions. And so we are so pleased to be co-hosting this event today with Results for America. And I'm really delighted to kick off the next portion of the program and to introduce Ben Harris. Ben is the Chief Economist and Senior Advisor with Results for America. He's also the Executive Director of the Kellogg Public-Private Interface at Northwestern University's Kellogg School of Management. He recently served as the Chief Economist and Economic Advisor to then Vice President Joe Biden and has supported the Biden-Harris transition team. Following his tenure at the White House, he was Senior Economic Policy Advisor with Rocos Capital Management. He's also worked on economic policy issues at Brookings and the Urban Institute. And prior to joining Urban, he worked at the White House as a senior economist with the Council of Economic Advisors. So he's got great depth and background and has great insight for us today. Ben, thanks so much for joining our conversation.
Thanks for having me, Terry. I appreciate it.
You know, clearly the release of the What Works report today shows the importance of evidence-based policymaking, but I really want to hear your perspective, so let's jump right in. RFA's Federal Standard of Excellence gives federal agencies a way to measure their progress in using data to really determine what works. We've certainly seen the importance of data and evidence in the context of COVID, both in data-informed and, frankly, data-uninformed responses. So from your perspective, how can we strengthen the role of evidence-based policy in the next few years as the country works to address the pandemic and its health and economic effects?
Well, I think that the role of evidence-based policy in the very near term and over the next few weeks and few months is just critical. We're in such a unique situation in our nation's history where we have a public health crisis, which has led to an economic crisis. The way out is going to be led by data and evidence, and it's most obvious when we're talking about a vaccine, for example. And there are lots of things we can do in the meantime to mitigate both the economic and the health-related harm of the pandemic. You know, obviously we can wear masks and engage in contact tracing and testing. From a public policy perspective, unemployment insurance and other social support programs certainly help. But as far as pulling out of this, one of the most important things, and really the only way out of this, will be the widespread administration of a vaccine. Now, we're at a point where there is an issue of public trust when it comes to a vaccine. And evidence, we're talking about scientific evidence here, is going to be crucial as far as the administration of the vaccine. Now, you know, I think that for people like myself who believe very strongly in scientific evidence and trust experts when they say a vaccine is safe, you know, it's disheartening to see public opinion around vaccines, and that, you know, feels like sometimes a large share of Americans may be reluctant to get a vaccine. But the data is actually pretty encouraging on this. So, you know, the United States is actually on the higher end of developed countries when it comes to trust in a vaccine. At the lower end, you've got Russia, where just over half of people reported being confident in getting a vaccine. The United States is in the high 70s. But in order to get that up closer to 100 and where we need to be, it's going to take a big push by, from a communications standpoint, communicating the safety and the scientific value of getting a vaccine. The second part where evidence-based policy is going to help us pull out of this is just around monitoring the economy. And it's been a real challenge. I think that by and large, researchers and government entities have stepped up. We have a census pulse survey, which has been incredibly informative. You've seen private companies playing a big role. So you've got Open Table, for example, reporting early on exactly the share of restaurants that were open. But we've got to get better at monitoring, for example, the health of small businesses. We don't have a good sense, even the number of small businesses that are open or closed or that might restart. We don't have a great sense of household finances. So, you know, that data usually comes in with a very long lag. And so we have to get creative when we're talking about monitoring the economy and the recovery. And the third part is that we've got to, you know, embrace data and evidence when we're talking about a recovery package. And Congress right now is engaged in discussions around a possible relief package that would include $908 billion for things like unemployment insurance and more money for small businesses. But eventually, when we pull out of this, hopefully we'll see something like we saw in 2009 when we saw ARA and the Recovery Act. You know, when you look at ARA, a lot of the success around ARA had to do with the fact there was so much transparency and accountability built in to that act. You know, if we see another recovery package come out, and President-elect Biden's been completely clear about his position on a recovery act, you know, my hope is that we'll see the same embrace of data and evidence, transparency, accountability that we saw in ARA. And not only just transparency and accountability, but also the willingness built in to shift gears towards what works. And, you know, if we find that a program isn't doing what it's supposed to in a recovery package, you know, it's important to build in the mechanisms to shift towards a different program.
So I want to pull on a couple of threads that you laid out there. You talked about the importance of public trust to recovery, to getting people to take the vaccine. When we think about evidence-based policy in the past, it's generally been a bipartisan issue. But coming out of this election cycle, you know, our nation is really deeply divided right now. And frankly, different groups trust and mistrust different data sets. So how do we get people to agree on a common set of facts?
Well, that's a tough question, as you know. And I think it's that the divisions in this country have been driven equally as much by differences in values as they have by differences in facts. But when it comes to evidence-based policy, there's a lot of bipartisan agreement around this. The Evidence Act, which passed last year, passed the House 356-17. RFA has done polling in conjunction with the University of Chicago and found that around 90% of both Democrats and Republicans support the role of evidence-based policy and policymaking. So there is a lot of bipartisan agreement around the notion that we should have evidence-based policy as part of government. I mean, look, everyone wants government to work. We might disagree on what's the appropriate size or the direction of various programs, but everyone wants programs to work. So at least we have this lowest common denominator to start from. Now, there's some things we have to get around. And one of the things we have to get around is what I think is sort of this perceived trap for those who want to advocate for evidence-based policy, but don't want to be part of necessarily shutting down government programs. So you've got to divorce the question of shifting resources to what works from the question of how big or small should government be, right? So evidence-based policy should not be this backdoor way to shrink or grow the size of government. It should be a way to make it more effective. Otherwise, it's I think going to be too divided and too partisan. The other thing I think that's important to do in order to sort of help with bipartisanship is shift the role of evaluation out of the private sector and out of not shift it out of the private sector or universities, but increase the role of evaluation in the public sector. And you saw that in the Evidence Act with the additional chief data officers at agencies, making it more easy to use and share data. But I think it's really important to have the federal government be an evaluator of programs. And right now that's partly been outsourced to universities and the private sector, but there really is a role for the public sector to evaluate programs for how efficient they're spending taxpayer money. RFA has long been a proponent of this with the 1% set asides and other strategies. But the point here is that government can play a role in not only just deciding how money is spent, but also determining whether or not it's being spent effectively.
So when we think about what works, obviously a big piece of that happens at the federal level. And I know later we're going to hear from some agencies who are actively engaged in measuring that. But the federal government has partners at the state and local level that help them execute these programs. So let's talk for a minute about the broader government data environment. How should federal agencies share data with and collect data from their state and local counterparts to really improve program delivery throughout the government ecosystem?
Yeah, it's a great question. I mean, the way that we administer so many programs, there is a true intergovernmental aspect. I mean, so much of what we do, from infrastructure to health, just involves cooperation between governments at different levels. So obviously, it's really important to have this strategy where there's participation across state and local and federal governments. The answer for getting there, it's not that sexy. I mean, you've got to have the will, but a lot of times you're just talking about building up an infrastructure for doing it. And it's things like, things that you saw in the just released federal roadmap out of RFA, but things like model data sharing agreements or data licensing agreements. It's things like data standardization, downloadable machine readable data, de-identified tag data. And so, it's really putting into place the legal and empirical infrastructure for sharing data. Now, it's not that sexy. No one gets really excited about talking about machine readable data, but that's what you need. I mean, you need the infrastructure for it to work. And so, very encouraged by the Evidence Act, very encouraged by the efforts of RFA, the participation of the federal agencies today. For people who are living it, I think that they know that, look, this doesn't always come with this, there's no silver bullet, but it's really just the blocking and tackling and building up that infrastructure that matters here.
Are there steps that we can take right now to make that process easier or more effective? I mean, if we all know what it is, why aren't we all doing it?
Well, I do think the Evidence Act was a big first step but it also it's not just the federal government, but it's also partners at the state level. So, RFA doesn't have it's not just a federal standard that it also has state standards. There's some really terrific examples in there. So for example, the RFA highlighted the work in Connecticut that had a 2014 executive order that did things like, I'm just checking my notes here, but it designated a senior data officer at every agency in the state. It created the position of chief data officer. And so, it's not just a big act like the Evidence Act, but it's also the states being willing to participate. And we have some truly terrific examples from around the country of when states have built up that infrastructure. You know, and you know, I'm not a governor, but if I were, I would embrace these type of efforts. My hope is that when coming out of this current pandemic, when we all see the importance of having a government that can respond quickly and efficiently to crises like this, and we go back, we sort of ask what we could have done differently. I think that putting in place a better data infrastructure will be one of those things, not just for monitoring, but also for targeting resources. You know, that could have been done a lot better in the pandemic. And maybe part of that at the state and local level, we'll see a little bit more enthusiasm for these type of efforts.
So let's take that response, down one more level as we talk about what works. One of the objectives of many government grant programs is to increase equity. And so given the disproportionate health and economic impacts that communities of color have faced during this pandemic, how would you suggest the use of data and evidence to increase racial and social equity?
Well, I think the pandemic you're certainly right. It hit communities of color much harder than other communities. Everyone has been affected by this, but certain communities and certain families certainly were disproportionately impacted. But racial inequity has been an unfortunate part of our economy for a long time. And when it comes to using data and evidence to help rectify this, I think that there's a few promising strategies coming out of the pandemic. This is a longstanding problem. One is around wealth building, and it's really striking how much money is devoted towards wealth building from the perspective of tax expenditures. Like, every time we're talking about subsidies for 401ks, every time we're talking about subsidies for home ownership, which is a major source of wealth, we have devoted almost nothing out of that enormous pot of money towards evaluating what actually works. And so, I think that I'm really encouraged by the potential for better data around wealth building, having a data set that can follow families over time. We have really poor panel data sets when it comes to wealth. That's critical to studying what actually works. We also need far more dollars for evaluation, for evaluating just wealth building with families. I think that's a really important step. The second thing is is also, from a work perspective, so much of the inequality that we're seeing is driven by inequities in wages. And economists have been debating for a long time as far as how you can raise wages, but it's really time for us to put in place more systematic steps towards evaluating what can drive wages. And DOL has been a leader. There's been a chief evaluation officer at that agency. It's been incredibly active. But we need, this is such a massive problem. We need more than just one chief evaluation officer, one agency to help tackle it. Beyond that, I think that we also need to think hard about what we're actually measuring. And, just to give one example, coming out of the pandemic, we saw the PPP program, which was designed to support small businesses. It worked okay. There were a lot of businesses that were left out, particularly in communities of color. But look, there were a lot of businesses that weren't measured at all. There were all cash businesses that are far bigger parts of marginalized communities and wealthier communities. And these just weren't being measured. We talk about people who have dropped out of the labor market. I mean, these are people who are really not measured. And so I think we need to do a better job of measuring the parts of the economy and the families and businesses that aren't captured. And that's a big part of closing the racial wealth gap. But when it really comes right down to it, it's about wealth building, and it's about wages, and it's about social well-being. And we've got to get better about collecting the data for that.
I think what I hear you saying is that data and evidence are the key to get us out of just theory and into practice with practices that we know will work. What would you suggest, or what are some things that the Biden-Harris administration and the next Congress can do to help accelerate progress in evidence-based policy?
Well, part of it, there are certain things we know that do work. And sometimes it just comes towards taking the will to make that step. And so, for example, I spent a lot of time studying retirement, and one of the best ways to get people to actually put money in a retirement account and get more families into the stock market. And the stock market, one of the characteristics of the current recession is the stock market is doing great, while a lot of families are doing poorly. If there were more families involved in the stock market, the pain would be less. One of the best ways to get families in the stock market is through automatic enrollment. We know that. We have dozens of studies around it. It's just a matter of putting the will in place to actually get people into those programs. And so I think that also, you look at the rest of the agenda from the Biden campaign, there are lots of aspects you can say, sort of, again, to embrace this data and evidence perspective. Just to take one example, as a candidate, Joe Biden embraced the EEOB's plan to make workplace data more accessible and more informative. So not just collecting data around race by employment, but by also wages. So we can take a hard look at the wage gap. Just throughout the whole campaign, you see all these different examples, whether we're talking about wages or we're talking about housing, that a big component of that was actually measuring what's going on in order to fight that discrimination. So, I'm really encouraged by what's going to happen. Some of that can be done by executive order. Some of it has to be done by legislation. But it's a combination of the will for doing what we already know works, like automatic enrollment, and then also putting in place that data infrastructure to measure how people are doing.
Well, sometimes it takes a crisis to motivate us to move to some of these new practices. So maybe the time is right for a lot of those. What do you see as really the next frontier on federal evidence-based policymaking?
So there's a few areas that are exciting right now. One is that if we go back and look at the work that Raj Chetty did and his co-authors, and it's not just Raj, it's a lot of other economists who are part of it, but that's the mobility data where they looked in particular at how people did relative to their parents and how geographic mobility varied across the country. And it just advanced in one set of studies so much about what we knew about mobility in the United States. And that was all brought about by the fact that we could link administrative and survey data. And so I'm really excited by, we know this is a really powerful set of data. But if we have panel data sets where we can link survey and administrative data, we can learn so much more about problems. And that's just one example where we tried it and we learned so much more about mobility. But there's other things that we can apply it to. We can apply it to health. We can apply it to unemployment. We can apply it to wealth building. We can just really, across the board. But that strategy was really exciting. So I'm hopeful to have an administration which is willing to, again, sort of repeat the success of what Raj Chetty did. Another thing which I've written about and I'm really excited about is the evaluation of tax expenditures. And so in the United States, we have essentially three different budgets. We've got mandatory expenditures, which are things like Social Security and Medicare. We've got discretionary expenditures, which are typically appropriations. But then we also have this tax expenditure budget where we forego revenues that cost the Treasury and everything from the mortgage interest deduction to the exclusion of employer-provided health insurance. But we spend about the same on tax expenditures as we do on appropriations. But the difference is that appropriations are regularly evaluated. There's an appropriations process. There's inspectors generals. Through mandatory spending, there's sort of a similar level as through discretionary. But when it comes to tax expenditures, you just kind of go on. Just every year after year, we've had a mortgage interest deduction since 1913, and we've never stopped to ask whether or not it's a good way to get people in houses. So, I'm also optimistic about evaluating tax expenditures, maybe putting in place a system where tax expenditures can be looked at by a federal agency and evaluated so that members of Congress can, understand which tax cuts and tax breaks really do work and which ones don't. So those are just two examples of areas I'm really excited about. And again, RFA's 1% set aside is just one of the best ideas out there. I think it's really important, and I hope it gets adopted.
Well, it sounds like you see a pretty bright future for data and evidence-based policies and programs going forward.
Yeah, I mean, one, it's one of the few areas that is bipartisan and that you have support on both sides of the aisle. And two, I mean, studying things and using those results to solve problems has been how we've advanced as humans, and that's not going away. So yeah, I am excited about it, and I'm just really hopeful for once we get past this pandemic towards focusing on other problems.
Well, Ben, I know that this is a really busy time for you, and so I want to say thank you for making the time to join the conversation today.
Thanks, Terry. I really appreciate it.
And now I'm going to turn it over to Josh Inaba for the next portion of today's program.
Great. Thanks, Terry and Ben. I think, as Terry just mentioned, there's a lot to look forward to, as Ben has described, with evidence-based policymaking. I'm really excited today. We're joined by 8 federal agencies that participate in our Federal Standard of Excellence, and they are going to talk about how they're using data and evidence in their day-to-day business. But before we dive in, I want to thank all these agencies for joining us and participating in our Federal Standard of Excellence. I also want to commend them for their leadership on the evidence movement and their demonstrated commitment, as you'll hear today, to really improve lives and results for families, children, and communities across the country. So thank you to them all. So I do want to just sort of resurface a few key points that were mentioned earlier today. There are 9 federal agencies in our Federal Standard of Excellence. They've made significant progress on implementing the Evidence Act, even in the middle of a global pandemic. And as Judd Herrmann described earlier today, a lot of them have exceeded the law's requirements in many ways. And it's really clear that these agencies, as you'll hear today, are taking data and evidence seriously. They're transforming the way that they do business so they can really deliver better results across the country. So with that said, these agencies in the Federal Standard of Excellence remain the leaders in evidence-based policymaking and continue to set the example for other agencies to follow. So now let's find out how those agencies have laid the groundwork for that future of evidence-based policymaking. Before we start the panel, I'd also invite participants to chat any questions that they have for the panel. Hopefully we'll have some time to take them at the end. Feel free to use the chat function there. So we'll kick off our panel. Our first agency to join us is the Administration for Children and Families. Amy Goldstein is the Deputy Assistant Secretary for Planning, Research, and Evaluation at ACF. Naomi, can you tell us about some of the choices you made in developing the ACF Learning Agenda?
Josh, thank you so much for asking. So we have not yet published our learning agenda, although we hope to do so soon. But it turns out, like the character who discovered he'd been speaking prose all his life without knowing it, we have had many of the elements in place for a long time. And in the process of pulling those elements together and documenting our activities, we faced a number of choices and have become more intentional about some of the things that we were already doing. I want to note that as a sub-cabinet agency, we're not required under the Evidence Act to develop a learning agenda, so we have the luxury of approaching this effort as we think best, and there's no danger of our regressing into a compliance exercise. So to look at scope first, for our first pass at creating an ACF-wide learning agenda, we decided to limit our scope to research and evaluation activities. In future iterations, we hope that we'll expand to also include other types of learning, performance management, grantee monitoring, review and analysis of administrative data. And our forthcoming document is related to 2 other levels, at least, where learning agenda activities are ongoing. At a very broad level, HHS has developed a learning agenda in response to the Evidence Act, and we participated in this broad effort and provided content. And at a more focused level, my office is developing more detailed learning agendas in collaboration with individual programs within our agency, such as TANF, the Temporary Assistance for Needy Families Program, Head Start, and many others. And we drew on these more focused efforts in developing our ACF-wide learning agenda. So I mentioned that we were not starting from scratch, and some of the elements already in place included the program-focused learning agendas that I just mentioned. And very importantly, our ongoing conversations with our program partners to take stock of what we know, review what we're learning, identify gaps, and prioritize new work to meet program needs and interests. For a number of years, we've published annual reports describing our current portfolio of studies, and we're working to inventory data across the programs in our agency and to work with our program partners to improve quality and usefulness of administrative data. Having a head start was both an advantage and a challenge when we set out to develop a more formal unified ACF learning agenda. We didn't want to undermine ongoing activities or ask people to reformat existing work just for the sake of consistency. But we didn't want to just stitch things together like a crazy quilt. That might have been confusing and unwieldy with too much detail for an agency-wide perspective. So we developed a template that's organized around programmatic areas. And in each area, we describe past research and evaluation, discuss stakeholder engagement activities, provide examples of broad questions guiding our work, and describe ongoing and planned studies. I hope it's already clear that I consider the process of developing a learning agenda, the activities, the conversations, the joint planning, to be at least as important as the production of a document. Indeed, we call our document a snapshot because it's only a static picture of a dynamic process. And in this process, relationships are key, including ongoing dialogues with many stakeholders and especially the partnerships between our research office and our program partners. At the same time, I believe the document itself will be very useful. I hope it will provide a frame for these ongoing conversations. I can see it supporting continuity, helping us maintain a focus on questions of enduring interest as we also aim to meet the needs of the day. And I hope the document will be useful for audiences and users both within and outside our agenda. So we're looking forward to publishing our agenda soon and getting feedback. Thank you.
Great, wonderful, Naomi. Thanks for sharing about how you're building such a thoughtful process. It's really promising and exciting to hear. Now I'm going to turn it over to the Administration for Community Living, Susan Jenkins. As the Director of the Office of Performance and Evaluation at ACL, my question is, how has the agency's efforts to strengthen data governance improved the agency's evidence building capacity?
Thank you so much for having me. Much of our work in this area has been part of the ACL Data Council, and we started our ACL Data Council in late 2019, but most of the activities occurred in 2020. We bring staff together from across the agency to identify data governance issues, and it's been a very positive experience for us. We developed several products over the course of 2020, including an annotated bibliography of existing federal data standards, frameworks, and models, a data governance primer, and an infographic related to improving data quality. We learned some lessons in terms of staff capacity, particularly in the time of COVID, and have slightly restructured our council for the second year. And we will be using staff more to generate ideas and to review documents, and our contractor support to develop those documents and to do the primary research that we need related to developing various documents. And at the end of the first year, we asked the members of the Data Council what they thought were the benefits of the Data Council and this evidence building area. And they said that it was very helpful for identifying data gaps in our agency, ACL, in gaining a better understanding of ACL programs. We were able to share effective data practices across various different ACL programs, and it helped to strengthen our interagency relationships and collaborations with several guest agencies that we had come to speak to our meetings, guests from the Department of Homeland Security, as well as the Social Security Administration. And so building our data governance structure really has helped us through these conversations and this communication and the process, something that Naomi mentioned. The process has been really important for us building our evidence capacity. And in 2020, there are a few other areas that we've made very nice strides in. We were able to publish our learning agenda, and as Naomi mentioned, for her sub-agency of HHS, we are also a sub-agency and not required to produce our own learning agenda, but we were able to do that and published it in September. And it focuses on our agency work on formal and informal caregiving. So it crosses the entire agency, but focuses on one primary topical area. And having the learning agenda to focus our efforts has spurred important conversations across the agency and helped us to plan a series of learning activities that will improve agency programs. And the work on that and our evaluation plan also improved staff understanding of the range of work that we're doing and raised awareness and coordination across our staff. We also this year were able to publish 4 toolkits on performance measurement data quality, logic models, strategic planning, and they've been very well received. The one for strategic planning in particular led us to present at a larger departmental event and helped us to facilitate strategic planning in offices across ACL. So we started with ourselves and now we're moving to some of the other centers within ACL. And all of these things have helped to increase communication across and within the agency and helped us to build our culture of data and programs, things that we hadn't worked on before, programs that we hadn't worked on evaluating before have come to us and approached us to help them with evaluation challenges, data challenges, and things like that. And those conversations that support that reciprocity really does help to build our evidence capacity. And even with these achievements, of which we are so proud, if you look at our scores in the federal standard, you'll see that we are still struggling with using evidence for competitive and non-competitive grant making. So as we move into 2021, that's an area that we will turn to try to make some strides in that area for next year. So thank you for the chance to show a little bit of what we've done this year.
Thanks, Susan. I just love how the Evidence Act has really helped you all not just comply with things, but sort of move beyond that. I think it's really showing here today so far. Next, I'd like to introduce Winston Allen, the Agency Evaluation Officer at the U.S. Agency for International Development. Winston, USAID is a relatively small federal agency with an international affairs focus. Yet the agency is quite far along in Evidence Act implementation. And it sounds like other agencies have been reaching out to USAID for advice on how to put together a learning agenda and an evidence capacity assessment. Can you comment on why you think USAID plays such a large role in the federal government despite its comparative size to other agencies?
Yeah, thank you very much, Josh. And thank you for inviting me to participate in the panel. And I would also like to thank Results for America on behalf of USAID for the work you're doing to promote the generation, management, and use of evidence in policymaking among federal agencies. Yeah, your question is a very good question. So first, I'd like to say USAID is a very unique agency by virtue of the context in which we work. We're an international agency. We focus on international development primarily, and we do work in very complex environments. For example, we work in some of the poorest countries of the world. We work in areas that you may refer to as non-permissive environments, or we work in countries that are sometimes referred to as fragile states. So given this context, having the right evidence to make policy or programmatic decisions is central to the operations of the agency. In fact, since the founding of the agency in 1961, it has been conducting evaluations, primarily to generate evidence to make the right policy and programmatic decisions. However, this was not consistent in terms of the conducting of the evaluations. So if we move fast forward to 2010, I would say at that point was when the agency itself strategically made the effort to transform itself into a learning organization. And at that point, the Bureau for Policy Planning and Learning was formed, and that's where I am. And then the first action that was taken by, one of the first action that was taken by that bureau was to establish evaluation policy, an agency evaluation policy. And from that point on, evaluations had been conducted consistently. Then with the Evidence Act, by the time the Evidence Act was coming up, we also had a learning agenda, an agency learning agenda, which is currently guiding learning across the agency. So as missions develop their strategies, they're identifying learning questions and that are specific to their context, but these questions are aligned to the agency learning questions. And because of the work that we do in development, capacity building is a very important function, because in most countries where we work, we really try to make sure that we we strengthen the capacity of these countries so that they can do the work for themselves. At the end of the day, when our activities have been completed. So the Evidence Act has really been important to us. So the last year we've been focused on meeting the requirements of this act. So even though we've had an evaluation, we've had a learning agenda, we've tried to adapt the learning agenda to meet the statutory requirements of the act. And part of what we're doing now in terms of learning agenda is really to socialize it across the agency. We recently had what we call a self-reliance learning agenda week, which was a virtual event just like this, which had over 500 participants across the agency. And we're also working now on really getting a sense of the capacity of the agency itself to generate and use evidence. And part of that study is about to be implemented. It's a survey to get a sense of the capacity of the agency. And we've developed the FY 2022 evaluation plan. And for that plan, we're now providing technical support to the missions to continue to develop these evaluations and help them in terms of their procurement of the evaluations. So overall, I would say USA has been very in the forefront of evidence. And as we're implementing the Evidence Act, we've been interacting with other federal agencies. And in that process, we've been sharing some of our experiences with them. So that's in a nutshell how we get to, even though we're small, we get to influence some of the evidence activities. Thank you.
Yeah, thanks, Winston. Yeah, at RFA, we've heard about how USAID has been a model for other agencies, and I think, definitely keep tabs on things like Go Live from USAID as they continue to implement the Evidence Act. I'm excited to introduce Mary Hyde, the Director of Research and Evaluation at AmeriCorps, to talk about evidence and grant making. Mary, my question for you is, how is AmeriCorps planning to support grantees with implementing evidence-based interventions? And how will the agency continue to build evidence as interventions are replicated?
Thanks, Josh. And thank you for that question. I think to pick up on the thread of iteration that Melody introduced at the top of this conversation, I will bookend my remarks with that idea. I think the information that you see here on the screen reflects not just 4 years of investment in incentivizing evidence-based interventions and investing in those interventions, but it also reflects at least a decade of intentional efforts on the behalf of the agency to increase its attention and focus on how to build evidence, how to prioritize funding around evidence, and then it has positioned us, quite frankly, for the next 10 years of how we continue to build a pipeline of evidence and how we continue to support the field in using evidence-based interventions and using research to develop programs on the front end as well. So you see on the screen here the increase in our investment in evidence-based interventions. And I think that reflects in many ways our agency's ability to take service grants to the next evidence level. And I think at the heart of all AmeriCorps programs is evidence, the data and reporting that measures program performance. The stronger the evidence, the greater the confidence that the program is effective. And I think this agency, particularly our programs like AmeriCorps State and National and historically the Social Innovation Fund, have really intentionally provided strategic grants to organizations that engage in service and social innovation to address local and national challenges. What you see here are figures from the AmeriCorps State and National investment in grants, and these grants help build organizational capacity and expand effective programming while also assessing program performance across the evidence continuum. This helps our agency maximize the impact of federal dollars. Through our strategic grant making and collecting evidence, we measure program effectiveness and how populations are impacted by service. We can grow the list of effective programs with proven outcomes by cataloging successes. We demonstrate the efficient use of federal funding by investing in program models with real impact. We're able to reach more people by providing insight into how to replicate and scale effective programs. And I'll come back to this point in a moment. We can also help increase the understanding of national service and its role in addressing national and local challenges. So you see here that in 2020, 51% of AmeriCorps State and National competitive funding was invested in programs with moderate to strong evidence of effectiveness. ASN has increasingly invested in what works by supporting programs with moderate to strong levels of evidence. We had 29% of dollars in our competitive grant dollars invested in evidence-based interventions in 2017. And in 2020, we see that figure at 51%. And that is in large part as a result of very intentional integration of evidence into our notices of funding and by design, ensuring that evidence is part of our thinking. And this progress has really been a result of a strong collaboration with our program colleagues. Embedding evidence into program policy and shifting investment priorities requires not only the building of evidence, but also a genuine commitment to act on that evidence. The figures in this slide reflect that commitment and symbolizes a shared accomplishment. And in fact, as early as this morning, I was talking with one of my program colleagues about how we continue this in the next 10 years. Where do we take this? It's part of a strategy to take these types of proven and promising interventions and introducing them into communities that will hopefully expedite investing and using interventions that have shown demonstrated results. So we are positioned for the next 5 years with 2 particular projects to continue building that pipeline so that research and evidence is integrated all along the life cycle of a program, from the development of an idea through the testing of that idea to testing whether or not someone taking an evidence-based intervention off the shelf, if you will, and replicating it in their community, evaluating whether or not adaptions are met or needed because of local context, and whether or not similar outcomes are achieved. We've also just completed a 5-year project that has developed a portfolio of products designed to help people interested in replicating an evidence-based intervention. And we're hoping in the next, 1, 5, 10 years to develop an intentional capacity building and technical assistance initiative that will help take those lessons learned and support grantees who want to continue to try and take these models and introduce them into their community. And hopefully it will take them to a quicker set of results, building on the lessons learned from these other programs. So I just want to recognize my program colleagues in this effort. It's truly a collaboration. We consider our investment in what works as an important strategy for achieving our mission at the agency, and that is improving lives, strengthening communities, and facilitating civic engagement through national service and volunteering. So thank you, Results for America, for giving us the opportunity to share our agency's progress on both building and using evidence.
Great, thanks, Mary. I love this particular graph every year when we get it to see the increasing investments. And I think, you described supporting grantees and building a strategic pipeline is huge in this part of evidence-based grant making. So congrats on your work.
Thank you. We love the graph too.
From the Department of Education, we're joined by Jessica Ramakis, Director of the Grants Policy Office. Jessica, can you expand on how ED's competitive grant programs are leveraged to use and build knowledge and evidence in education programs?
Thank you, Josh. I'm happy to be with you to share about the important work the Department of Education is doing And it's great to see that current and former colleagues at the Department of Education have joined us today as well. Because like Mary mentioned, for AmeriCorps, the Department of Education has been advancing its work on the use of evidence and grant programs for over 10 years. And we look forward to continuing to build on the great work that's been done to date. Our grant programs give us the opportunity to build and use evidence of what works to best serve students. We make decisions whether to focus more on evidence building or supporting evidence-based models on the body of evidence that is available. That involves collaboration within the department, including working with our Institute of Education Sciences. As shown on our slide, over half of the competitions at ED last fiscal year used evidence components in some way. 40% of competitions ED ran last year included an evidence-based project component. As an example, that could include if in the program statute, based on the level of evidence, we support evidence-based models in literacy programs, for example. Almost as many competitions required the use of a logic model involving a clear connection between activities, near-term, and then ultimate outcomes to support evidence building. And then about 1 in 5 competitions included the next level up, promising evidence. And that level requires evidence of the effectiveness of a key project component in improving a relevant outcome. And 6% of our competitions included moderate evidence, which is a higher level of evidence that focuses on more proven strategies. To support this work, we make connections within and across the department with other agencies and with our grantees to learn from each other. And we partner with our grantees to share results with the field more generally. Our mission at ED is to promote student achievement and preparation for global competitiveness by fostering educational excellence and ensuring equal access. And that's something that I think we all always care about, and these times and the disruptions caused by COVID-19, it's really come to the forefront the importance of being sure that students are getting opportunities to learn and meet their potential. Our grant programs give us the opportunity to support innovation, building and using evidence of what works to best serve students. So we think they're an important policy tool and opportunity to contribute to the learning in the field.
Great, thanks, Jessica. We also really admire ED's efforts to really infuse evidence in your grant making processes. I think it's truly a leader in the field, so thank you. So now I'm gonna turn it over to Casey Dunning, the Director for Results and Learning at the Millennium Challenge Corporation. Casey, I know that MCC has been focusing on the use of evidence in FY20. Can you tell us more about that and why MCC is so focused on this component of the Evidence Act?
Sure, thank you so much, Josh, and a huge thanks to Results for America for having this event and doing the index this year. The Millennium Challenge Corporation is a relatively small independent U.S. foreign aid agency that offers grant assistance to developing countries around the world to focus on reducing poverty through economic growth. And we're quite lucky in that we're only 16 years old, and a key part of our founding legislation was incorporating evidence-based decision-making and policymaking into our model. And so the fact that we were built with this foundation really allows us to kind of aim to be at the forefront of evidence and its use, and making sure that we have the evidence to back up all of our investments. And another kind of aspect of this is that because we were founded on the use of evidence for our investments around the world, we've kind of set up an expectation from our stakeholders, just like RFA, all around the community, on the Hill, in think tanks and NGOs, that we use evidence and that we continue to push the bounds of how this works. And this expectation that MCC continues to focus on evidence, and now, of course, with the Evidence Act, further codifying how and the best ways to do so. It really helps MCC to push and holds us to account for actually using evidence. And this is why tools like the index and the federal standard are so helpful in making sure that we're continually getting better and doing what we can. I think a key part of evidence use and the Evidence Act is both the building of evidence and the use of evidence, and we actually saw this on Jessica's last slide. And so in the last kind of 15 years, we had really focused on generating the evidence and making sure that we had all the evidence and the tools to make our investments. And now MCC is really focused on making sure that we have the tools to use all of those reams of evidence appropriately and make sure that it's accessible both to our internal stakeholders on the program side and all over the agency, but also to external stakeholders, whether policymakers or researchers, whether those who need kind of quick information or really are looking for those long technical reports. And so what we've started to really do is build out a landscape of evidence products that speak to each other and are kind of nested within each other. And that allows us to make sure that we are able to get the right information to the right stakeholders at the right time. And I think this kind of shift to a proactive approach for evidence use has really served MCC well, and we're starting to see the dividends of this. And so just to give you a sense of how this works, so we have an independent evaluation for every single project that MCC invests in. And so with the results of that, it's often a 200 plus page report that has the findings, the good, the bad, the ugly, the learning, and how MCC funds achieved a certain result. And so now what we've done is using that, we have a number of other products that are connected to it. So there's an evaluation brief that is 4 pages long, super succinct. It's designed for the policymaker on the go who wants to know what happened in a given project. There's larger sector packages, which MCC is about to roll out, that take all the sector learning in a given sector. So that combines multiple evaluations across our global portfolio. There's our new STAR reports, which are country-based looks. And so if you want to know what happened on a suite of evaluations in a given country, you can turn there. And there's also our principles into practice reports, which combines all of the evaluative learning and synthesizes it into how we learned and how we are applying that learning moving forward. And so we've really kind of moved from a supply-driven model to a demand-driven model, thinking about how folks use our evidence, what they use it for, like whether it's in DC or in our partner countries, and to have that information at our fingertips so that we can share this good evidence with all of our stakeholders. Thanks so much, Josh.
Yeah, thanks, Casey. And we've seen the growth of like the evaluation briefs last year, and we're really excited for the sector packages. So I commend you all. I think, as you mentioned, and I think what other agencies are talking about is the need to communicate how they're using evidence actively. So great work.
Thanks so much.
I just want to mention that we will likely have time for questions for the panel. So audience, feel free to drop in any questions that you have in the chat. From HUD, we're joined by Jennifer Turnham, Director of the Policy Development Division at HUD. Jennifer, considering HUD's past experience in developing learning agendas, have the requirements of the Evidence Act changed HUD's strategy and approach to crafting the learning agenda moving forward?
Thank you, Josh, and thanks to Results for America. And good afternoon, everyone. So my office at HUD, the Office of Policy Development and Research, has led a department-wide effort to develop a comprehensive learning and research agenda since 2011. And we call our learning and research agenda the research roadmap. We produce the roadmap on a 3-year iterative cycle of stakeholder engagement that identifies priority research questions, and it's also designed to put together projects to answer those questions. It's a forward-looking document and it provides a roadmap, as the name suggests, but it's continually updated. So when the Evidence Act was signed into law, we were already beginning the process of conducting stakeholder outreach to develop our third research roadmap, which would become the 2020 roadmap. And at that point, we began examining sort of the requirements for an evidence building plan and a learning agenda. From its beginnings, HUD's research roadmap was built around the key principles of extensive stakeholder engagement and identification of priority research questions. And so for the 2020 roadmap, for example, we identified 109 priority research questions out of more than 600 research questions submitted by stakeholders. And we had also developed short research project proposals that responded to these priority questions. And our initial assessment was that we could address the Evidence Act requirements for a learning agenda through modest enhancements to the roadmap and without changing our overall outreach process. However, when we submitted the draft 2020 roadmap to OMB's evidence team for review as a learning agenda, they had some concerns. And the preliminary recommendations were that the list of research questions really should be shorter and more focused, and that including specific research project proposals wasn't really helpful or appropriate for a learning agenda. So given that feedback, we moved forward to publish the research roadmap without further changes, but we're publishing it as a research agenda, recognizing that it's not a learning agenda as envisioned by the Evidence Act and OMB. And so you can find the 2020 research roadmap on huduser.org, and we welcome feedback. And then in the coming year, in 2021, we're going to be building on the roadmap's outreach and prioritization process to develop a separate, more concise learning agenda that aligns with HUD's next strategic plan. And we expect that agenda to be different from the roadmap in that it'll have a shorter list of research priorities, and it'll also emphasize evidence building strategies, tools and techniques rather than specific research projects. So I think both documents will be extremely useful, and it's been an interesting process to sort of move from the roadmap to the learning agenda and think about the differences between the two. So thank you.
Thanks, Jennifer. We'll look forward to that updated learning agenda. I will now turn it over to the Department of Labor, our last agency to speak today. I'd like to introduce Lauren Dami, the Deputy Director of the Chief Evaluation Office. The idea behind the learning agenda is that it's an iterative, cyclical process where the information that is learned through the various activities continuously feeds back into the learning agenda itself. And those learnings are used to inform decisions about programs, policies, and regulations. So Lauren, as you're thinking about DOL's learning agenda, what are some of the ways that your team plans to make sure that evidence produced from the learning agenda activities are then used and continuously feed back into that virtuous cycle?
Thanks for that question, Josh, and thanks to Results for America for inviting me here to speak today. Well, maybe I can talk briefly about that, and then I wanted to talk, because I'm going last also, and since other agencies have talked about their learning agenda process, I wanted to talk a little bit about how a federal agency's evaluation function has sort of pivoted in the context of COVID, because I think that might be a sort of an interesting change up. But as far as your question goes, I think that there are a couple ways that we try to make this a virtuous cycle. One is by being helpful to our stakeholders. We develop a lot of resources that are all internal requests from Department of Labor agencies. We provide feedback, including technical reviews to work that's done by research that's done by other sub-agencies. We try to bring in other perspectives, so like a trusted third party to share their thoughts on research, including subject matter expert reviews, not only for the learning agendas, but for other work that our agencies develop. we really are trying to minimize the compliance aspect of implementing the Evidence Act in general. So we develop, one example of that is that we're developing parallel documents, those that support our reporting requirements, and then internal facing documents that are really tailored to meet the learning needs of our staff. And so, I mean, further to that point, we try to be really flexible about how we help staff identify opportunities for adaptive designs and innovation. So for our learning agendas, we have this really adaptive approach for both the learning agendas and the capacity assessments, where they may look different for different sub-agencies, and those are different internal documents based on their needs and how advanced they are in this area of work as well. And then lastly, I think it's important to build enthusiasm. We're trying to foster our own internal advocates within the department for evidence. And one of the ways that we do that work is by training staff and building their capacity to generate and use research and data. We have some internal training programs in the works. We offer behavioral science informed support to agencies for their own work, like A/B email testing and other tools and resources. And then we also have maintain the clearinghouse on labor evaluation research, CLEAR, which has a lot of different resources that I'll talk about briefly. So I did want to talk, though, just because everyone's talked about the learning agendas, I thought it might be, like I said, interesting to talk about COVID, because this is, the headline for the year. So I want to talk briefly about how we've been able to marshal really wide-ranging evidence in order to provide our internal and external decision makers with the most credible information available. So we've worked on like a short-term basis to provide real-time evidence-informed decision-making capacity to our stakeholders, and also put plans in place to develop longer-term learnings from our program evaluations. So I'm going to focus just on the employment and training programs in particular to provide a few examples. So as everyone knows, in March, we went from 282,000 to 6.8 million unemployed in 2 weeks. And the Department of Labor was responsible, or is responsible, for implementing a lot of the Families First Coronavirus Response Act, the CARES Act, and unemployment insurance responsibilities. And so one of the things that CEO has done to help pivot a little bit is develop rapid evidence syntheses. Like I mentioned, our clearinghouse usually focuses on impact evaluations and reviewing and rating impact evaluations, but we have this modified protocol that allows us to do these quick turnaround evidence scans, and a number of them are publicly available on our website for those interested. They're about return to work and employee retention strategies in response to COVID-19, and emergency response strategies in past pandemics. And we have a number of other topics that are coming up as well. And then we've also been able to leverage new data from a number of ongoing and new statistical collections, including those by the Bureau of Labor Statistics. For those of you who work in the labor area, you may already be aware that BLS added 5 new pandemic-related employment questions to the current population survey in, I think it was May. And so we have supported some trend analyses that focus on individuals with disabilities, for example, and to understand what's happening to them during the pandemic. And those are available on our website as well. And then lastly, just thinking about time, I wanted to mention that we are also supporting longer term learning through our rigorous program evaluations, which can be up to 5 years or more in length. And we were able to take advantage of the temporary contracting flexibilities that was offered to federal agencies through OMB earlier this year to modify a number of our active evaluations this past summer to add questions, for example, or otherwise change the data collection so that we could include information about how the pandemic is impacting people's abilities to administer employment and training programs, as well as to look at how individual participants in those programs are faring. And so we have a number of impact evaluations and other rigorous evaluations that look at a huge variety of populations, including, for example, homeless veterans, that will have data collections that are either happening now or next year, and we'll have results available in the next year. And so all of those evaluations are available on our website, and where you can also sign up for updates from us. Yeah, so I don't know if I'm over time, Josh, but I hope this is an interesting look at how our evaluation research functions are supporting the Department of Labor's employment and training work during COVID. And I'd love to hear from people if you find anything especially helpful or wanted to share how you've used this evidence. So thanks again to Results for America.
Great, thank you, Lauren. Actually very relevant remarks there, so we appreciate you sharing. And we also shared some links in the chat to some of the resources that Lauren has referenced. We're going to do a quick lightning round question. I'm asking each agency to very quickly respond, 30 seconds possible. My question is, for your agency or department, what would be most help to you to increase your use of data and evidence and improve results? Happy to start at the top with ACF. Naomi, if you have a response, feel free to kick us off.
I do. If I had to pick one thing, it would be streamlining the Paperwork Reduction Act. Thank you.
Thanks. Susan? Susan, yes. AC?
Yes, and I agree with what Naomi said, and also helping to streamline the ability to get data use agreements and share data across federal agencies. That would be very helpful as well.
Winston from USAID.
Yeah, in my case, I will say there are several things, but I'll say one of the primary thing I will focus on will be to make data more accessible and more user-specific, across the agency, for example, and in the countries where we work. And I know we're beginning to do some of that by creating dashboards, but I think having more accessibility and improving the culture of using data will be a great way to increase use.
Thanks. Mary, AmeriCorps.
I would request that there be greater attention to the professional qualifications needed to do this work and a recognition and investment in the human capital, not only into building the evidence, but also in some basic literacy for non-researchers and non-evaluators. I think that would do wonders to advance this work.
Totally, that's great. Jessica, Department of Ed.
Thanks, Josh. If I named one thing, I would name funding. While efficient use of our existing resources is paramount, we know that we would make really good use of additional funding for our Institute of Education Sciences and Program Administration. It would help us to ensure that Ed has the resources it needs to successfully implement the Evidence Act.
Great. Jennifer?
Thanks. Yeah, and I think this is something where there's been a lot of progress, but it's worth repeating, which is sort of consistent support from Congress for evidence building, paired with a commitment to using evidence for policymaking. So for example, no new program funded without resources and requirement for an evaluation.
Great, and Lauren.
Yeah, I have to say I echo Susan on federal agreements on data sharing and Jessica on funding, but for the Department of Labor in particular, we need better infrastructure to share and use data as a strategic asset internally as well as across federal government. So I think this requires some federal level guidance on this topic that would be really helpful for us.
Great, thank you for sharing. We had one question come through. Learning agendas were talked about a lot today. So the question is, I'd love to hear how agencies have, what were some of the surprising results that have come out of the learning agenda process that were unexpected or exciting? Is there a volunteer, one or two agencies that like to share some insights?
This is Susan Jenkins from ACL. Something that surprised us is we have been building our culture of learning for several years now, and we know that we have what we call several friends of data. But with the learning agenda process, a few people have really stepped up to show an interest in evidence building, how we're doing it, what we're doing it, what questions we're asking, and what we're going to do with the information. People that we didn't necessarily expect to step up, so we found some additional allies throughout the process.
Anyone else? And Casey, MCC, what is your one thing that you could use support on?
No worries. What we would like is to hear from you. So you are hopefully using all of this evidence work, and it would be helpful to know what's working, what's not. If there is a piece of research or a way that you would like evidence presented that's not available, that's what we want to know and hear so we can better have the evidence in a way that works for you.
Great, thanks. Sorry about that. Guess we can just do one more question. How are you all at the agency level thinking about building racial equity into your evidence-based practices? Naomi.
So I can say this is a really active conversation within our office and I think across federal evaluation offices as well. So we're trying to think about how we can ask different questions and think more actively about how to engage communities in the planning of research. So those are, I mean, I could give a longer list, but those are two sort of foremost things that we're trying to do.
Great. I also heard from Lauren that she wanted to just chime in really quickly, and then Mary will give you 1 second to add.
Oh, yeah, sure. So I completely echo what Naomi said. And one of the concrete things that we are doing in the near future is just better tagging our website so that it's easier for people to locate our studies based on the populations that are studied and the disaggregations that are available within the reports. And so I think even that basic accessibility issue is one that will hopefully be helpful for researchers who are looking to look at specific populations.
Great, thanks, Lauren. Mary?
Yeah, just two quick things. Like Naomi, this is a very active conversation in the agency right now, and there's a number of working groups thinking about how to use an equity lens with regard to grant making, recruitment of members, as well as employees. But specifically on the evidence front, we have been funding a participatory research grant program for the last several years, and we are thinking about how to expand on that, do that again, or integrate that strategy into additional efforts, because we feel that it's a very sort of equitable way in which you identify issues and conduct research in communities and then use that information for whatever action the community feels is most relevant. And then I would just add to the point I made earlier, I think that we are thinking about ways to expedite getting programs into communities and reducing barriers that, you know, sometimes under-resourced communities cannot take on, and just thinking about ways to facilitate that, support that more proactively, more intentionally, so that evidence-based work can get into communities with as few barriers as possible.
Great, thanks, Mary. We're running at time, but I'd like to thank our panelists. Thank you all for sharing your insights, participating with us on the Federal Standard of Excellence. You're doing excellent work. Thank you to our audience. Got some good questions, so we'll follow up with you separately. But I'll now hand it over to David Medina to close this out for the day. Thanks, everyone.
Yeah, hi, everyone. On behalf of the whole Results for America team, just wanted to thank our three speakers, Melody, Terry, and Ben, the several hundred participants who joined us today on either Zoom or Twitter, as well as our 8 panelists, Naomi, Susan, Mary, Winston, Jessica, Casey, Jennifer, Lauren. You and your teams are at the forefront of addressing 2 of our country's biggest challenges. 1, restoring trust in government, and 2, responding to the COVID-19 pandemic and related economic crisis, which are both ravaging our country right now, but which are no match for all of you data, evidence, and evaluation superheroes. Thanks to all of you for everything you've done this year. You've set a high bar for the next administration, and we will be there right along with you to help meet and exceed that bar. Please be safe and healthy, everyone. 2020 is almost over. So thank you all again, and we'll see you next year.